I'm Dr. Hannah Hamlin, and today I'm going to talk about what does normal blood sugar actually look like in someone without diabetes. This is a question I wondered often growing up, especially after continuous glucose monitors came out, wondering what does a graph look like in someone who's not experiencing diabetes? What does healthy, non-diabetic blood sugar really look like? And I think this is a helpful answer for people with diabetes as they're looking for goals and ways to optimize blood sugar, but also really helpful for people without diabetes that are starting to use continuous glucose monitors to optimize their metabolism and learn what's a normal metabolic response. So today we're going to go over just that. For someone without diabetes, blood sugar usually stays in a very tight range. Fasting blood sugar, meaning first thing in the morning before eating, is typically 70 to 99 milligrams per deciliter. After eating in someone without diabetes with a healthy metabolism, we would expect blood sugar to go up, but it usually doesn't go above 140 milligrams per deciliter. And as it spikes, it usually comes back down in 2 to 3 hours. Now, we do see excursions above 140 milligrams per deciliter in people without diabetes, and that's not necessarily physiologically abnormal, but the frequency that this happens is a clue that there may be some insulin resistance going on. That being said, it's also normal for our body to dump glucose from our glycogen stores in our liver into our bloodstream, and this can happen during times of stress and oftentimes of lifting heavy weights. So seeing a blood sugar excursion above 140 after a heavy workout isn't always a problem as long as it comes back down an appropriate amount of time, meaning less than 2 to 3 hours. Now, an average A1C in someone who is not diabetic is usually around 5%. So normal is considered anything below 5.7% by the American Diabetes Association. Now, what I like in someone without diabetes, if they're concerned about prediabetes or have a strong family history of type 2 diabetes, it's often nice to look at these hemoglobin A1C numbers and see if they change over time. If your A1C was 5% for many years and then it creeps up to 5.5 or 5.6 all of a sudden, it's a sign that there may be a way to optimize things. Now, how stable is non-diabetic blood sugar? Here's the part that people don't realize. In someone without diabetes, blood sugar rarely swings very high or very low. It might rise 20 to 40 points after a meal, and that's considered a normal healthy response. It is important to understand that in people without diabetes, those brief excursions above 140 can occur in healthy individuals, and the intent is that the blood sugar on average stays below 140 and stays in that A1C range below 5.7. Now, it doesn't usually spike to 180 or 200 very often unless there's a huge load of sugar, like someone drinks a soda, or if someone has insulin resistance. Now, that being said, even though we are seeing spikes up to 180 and 200 with a huge load of sugar, it doesn't mean that's a healthy response. It just means that potentially that sugar caused that. Now, at night, the body keeps glucose steady, usually in the 80s and 90s, and this is a really good goal. Now, what's interesting is these blood sugar ranges that I'm talking about, so 140 after meals, 80 to 90 throughout the night, 70 to 99 fasting, these are really the goals that we would give for someone with diabetes during pregnancy, because we know that these are safe numbers to optimize the pregnancy process. Now, this is not a medical recommendation. There are individual ranges given based on the person and their situation and other factors. And so it doesn't mean that these are the only goals for pregnancy, but in general, this is what we would typically see for most cases. So when we're thinking about what a blood sugar graph in someone without diabetes would look like, think about more of gentle, small waves instead of a big roller coaster. Understanding this baseline helps us see what the body is trying to do. Our pancreas, when it's working, is constantly releasing just the right amount of insulin to keep things stable, and that's what we try to replicate in type 1 diabetes. The challenge is that either the body doesn't make insulin, like type 1 diabetes, or it's not responding to the insulin well, which would be type 2 diabetes and insulin resistance. So the goal of treatment is to mimic the natural stability of blood sugar as best as possible. So to answer the question, what is normal blood sugar anyway? We're talking a fasting blood sugar 70 to 99 milligrams per deciliter. After meals, aiming for under 140 milligrams per deciliter, and an average A1C around 5%. That framework is what we compare ourselves to when we're managing our diabetes. We do have different goals for someone with diabetes because Taking insulin has an increased risk of hypoglycemia and impact on quality of life. And so we're not saying that everyone with diabetes needs to have non-diabetic numbers. We're just saying that this is what normal looks like. And for someone who's not diagnosed with diabetes or concerned about a future diagnosis, this is really where we would expect to see someone who is healthy metabolically. I hope this helps put things into perspective. If you found this video helpful, make sure to like and subscribe and share it with someone who could benefit. And if you want more tools to feel empowered living with type 1 diabetes, check the links in the description below for my free checklist and resources. Thanks for watching, and I'll see you next time.